Hello, I'm Dr. Ryan Kazemi, an oral surgeon in Bethesda, Maryland. Many of our patients have asked us whether or not it's safe for them to see their dentist during the COVID 19 pandemic. Of course, the safety and health of patients and healthcare workers remain the number one priority. And as you know, we all need to take our individual responsibility to make sure that we can prevent further spread of this devastating virus. So I would like to share with you the current recommendations surrounding COVID 19 and your dental health. The American Dental Association has put their position on COVID 19 following the recommendations from CDC. They have provided guidance to dentists and patients on how to minimize the risk of coronavirus transmission. Of course, these guidelines will continue to change as more information becomes available on its control. However, for the time being, dentists have been recommended to provide only emergency treatments and postpone and delay any elective treatments until further notice. Let's take a look at what constitutes an emergency treatment that should be managed right away by a dentist. These emergency treatments, as defined by the American Dental Association, include the following: uncontrolled bleeding, painful swelling in or around the mouth, pain involving your teeth or jawbone, infection of gum tissue with pain or swelling, post surgical treatments such as dressing changes or stitch removal, trauma, including broken or knocked out teeth, adjustment of denture for patients who might be receiving irradiation or other forms of cancer therapy, and assisting patients with braces who may have a loose wire that might be causing irritation to their cheeks or gum tissue, and also biopsy of any abnormal tissues. The American Dental Association has also conveyed a clear guideline for dentists and dental professionals on what truly constitutes dental emergencies that should be managed right away, which, as we talked about, includes uncontrolled bleeding, infection, and trauma, and also a list of procedures that are considered to be urgent that should be managed but as minimally invasive as possible in order to avoid further complications that may result in a patient being referred to a hospital emergency room, which is certainly not desired at this time. What's important to know is that the treatments that are considered to be elective should be postponed. What are those treatments? These include regular visits for exams, cleaning and x rays, regular visits for braces, removal of teeth that are not painful, treatment of cavities that are not painful, including any type of restorations or cosmetic treatments, and also teeth whitening. Let's now talk about the infection control protocol. What are the routine and expanded infection control protocols that should be followed when seeing emergency patients? Our routine protocol has always been following universal precautions, making sure that all surfaces are disinfected thoroughly between patients, frequent hand washing, all instruments, of course, being autoclaved, and using personal protection equipment, including masks, gloves, and eye protection. There are some additional expanded protocols that have been recommended currently in the light of COVID-19 pandemic. These include providing patients with a questionnaire and a screening, specifically asking them about the symptoms associated with COVID-19. Of course, if they have exhibited fever, coughing, and other symptoms, they should be directed to their physician or hospital for evaluation and testing. Additional protocol has been social distances between the dental team members in the office. Also, social distances between patients. So they are seen separate rooms and separate from each other in the reception areas. And also practicing what I call the one room visit, escorting the patients to the room where they're being treated and directly discharging them home. That way to minimize usage of various rooms, such as consultation rooms or discharge areas, where there can be more exposure to different surfaces. So, What should you do before you go to a dentist? These are some of the recommendations that we have provided to our patients, and also dentists have been providing to their patients across the country. First, if it's an elective procedure, as we discussed, simply wait. Your dentist should not see you for elective or non emergency treatments until further notice. Second, if you have any of the COVID-19 symptoms, do not go to your dentist office. Certainly recommend you to speak to your physician or go to a hospital for proper testing. If you do have to go to a dentist for emergency treatment, as much as possible, avoid accompanying others with you um, unless it's absolutely necessary. Finally, when arriving to the office, make sure that you thoroughly wash your hands on arrival and follow the social distancing protocols that we discussed. We're going to provide continued updates on our website, facialart.com, and also on various social media channels. We certainly wish you safety and good health as we all navigate through these very difficult times. Thank you.